So from our perspective, irrespective of the health benefits, the crime element that may or may not exist, I don't want to debate that. Sometimes it's just easier for us to say, let's give this more time. Let's wait for the state to continue to refine the law, and let's adopt more of a wait and see attitude. The other thing too is we're not an isolated community. We're not up north. We're not far away from another community. People who need the medicine, who need it, do have options of places that they can go. Ann Arbor is 20 minutes away for our residents. I'm not, I have to put our people first. Our residents can get to Ann Arbor in 20 minutes. I've toured the facilities in Ann Arbor over the years. Some of them are very nice. They're very professional. They've been zoned heavily by the city of Ann Arbor. And so those are options, again, for our residents. And it may be easier for us as a community to just say, we're going to call a timeout and we're going to get back later on this issue until other things get resolved. It puts you, and I know you are in a difficult position. I don't know what the terms are of your lease. I don't know what are you running any kind of business out of there
No.
right now? So you're paying a landlord, right?
Yes.
When does,
Well,
when does that lease expire, and do you have an opt-out or anything like that?
I'm not so concerned as to my welfare. It's kind of been a legal loophole based on building code ordinances the previous board has initiated so that I could not move forward. We'll just leave it at that. But if your community hasn't said they're against it, then why are you against it? You're here to represent your township, the people in your township.
Okay.
They're
And that's a political argument. We're familiar with that.
Okay.
I will tell you, I was the state representative for Plymouth Township for 6 years. I don't think we had anybody from Plymouth Township weigh in yes or no on this issue. After all of what I went through in the hearings on this law, which I voted for, this has not been a top drawer issue for any of us. I'm speaking for myself. I can't speak for the others.
Plymouth is a prominent, prestigious area. The residents are as well. They're not loud and proud. They're not passionate. They're not that type of medicator. They're not going to involve it in their not in their political, but in their professional aspect. The lawyer is not going to go out and say, yeah, I smoke. The doctor, the teacher, and the other prominent individual resident in the area. There's no reason that they should have to. It's their personal medicinal choice. Survey. You want, we don't have to, we can design it and plan it much better than the park survey. That we could even pay for it. There's enough people in this room who support it that would fund together, would get together and do it. I own a direct mailing marketing business. I've done direct mailers. We have people who can pay for it. I can design it. We can get it out there. If this is something that would intrigue, change the mind of, inform the township, it is something easily done. You tell us what you need and we can provide for it. The security, issues in the parking lot, those are things that can be addressed as well. A general, generic, the health, safety, and well-being, I just want some more elaboration on. There are things we can do for that. We can ask the public. We'll fund the asking the public. Would you like us to do that?
I'm not going to encourage or discourage public action with respect to your First Amendment rights. So, I'm not going to be yay or nay on that. I think it's important that I'm trying to keep it narrowly focused, the discussion onto the zoning and planning aspects of your operation, of your proposed operation. And, we can even have this discussion at a later date as well.
I know I've used a lot of time, and there is a lot more that they have drafted an ordinance, zone it in industrial, back in March of 2015. They had played the Planning Commission to do that. They had attorneys review it, draft it. We've talked to multiple attorneys. The previous board, I'm sorry, has utilized those expenses. They've gone through these steps. I've gone through these steps with them. It's not unheard of to review what they've already done, change it, correct it, and move forward.
Fair statement. Anybody else have any questions? I know you're way over your time, but this really, it impacts a business decision that you've made, and I think we want to hear from you and how it impacts you.
Yeah, and I know I've taken up more than my 3 minutes, plus a lot extra. And I would like to have a personal discussion on other options, avenues, things that have been done in the past that we can save the township time and money on and move forward with.
Okay.